Tidelands Georgetown has been in business here for nearly 70 years. So we've offered hospital services to the community for many, many, many years, decades. There have been a number of projects that we've done over the years. We have a lot of outpatient encounters and some inpatient encounters as well. And so what we really realized was that we were not providing the amount of the right services to our outpatients encountering our facility as we could be. It wasn't as convenient. We had multiple entrances for an outpatient. It's confusing to patients that are either elderly or sick or maybe just a mom in labor that the access to services around the facility didn't make a lot of sense. There were multiple locations to come in. So we began the process of saying we'd really like to make this idea materialize, this idea of relocating the primary entrance to the hospital to this side, and the only way to make that work was to have adequate parking and easy access from this side of the campus. So the board began to work in earnest to acquire the property necessary, and so the parking area that you see out there is part of it. So as a new patient, when you encounter our campus, the first thing you're going to see when you drive into this new public area is two primary entrances. One will be the primary main entrance of the hospital where all outpatients should enter. But there'll be a secondary entrance, secondary canopy area that will be the emergency department entrance for those arriving by their own vehicle, not for an ambulance patient, but all those patients who arrive by their own vehicle will be coming into this side of the building. So you'll approach our campus and see two primary canopies, one on the left that's the emergency department and one on the right that is really the entrance for everything else. It will be the primary entrance for outpatient activity, and even if you're going to visit one of your loved ones that are in the hospital right now. As you come into the new facility, what you'll see is, obviously a very lovely mall area. It's beautiful, it's open, it's airy, it's light. It has all of those features that we love about it, but it also creates much better access to the outpatient services that are behind me here on this side. So the first thing that folks will see is the ability to where they register for services that they have, whether they're coming in to become an inpatient or if they are getting outpatient services like imaging, where to register. The access to, again, the ER will be on that far end as well. And then right behind the wall here is actually where the existing imaging department has always been. But we've co-located all of the outpatient lab services, some of the outpatient cardiology services, right here nestled against the imaging department. At the same time there's work in completing the construction, there's been process improvement work by a whole team of folks in the hospital in the outpatient ancillary, billing, registration world who spent a lot of time trying to work on how do we improve this process for the patient? How do we improve this experience for the patient, especially the outpatients that have a lot of encounters in the facility, ER patients. There are probably over 30,000 ER encounters a year. So we spend a lot of time with staff to work on how do we improve that experience for the patients. And I hope we've accomplished that. I think the key message is we're reinvesting for the next 70 years and making sure that we have the facilities and services needed that the patients need. Again, very, very focused on outpatient service delivery. So many more encounters with outpatients than we have with inpatients. We want that stay to be fantastic as well, but we need to be more accessible, and this project's going to help us do that.